In older adults, use oximeter rather than temperature to screen for COVID. Scientists. The reliability of a pulse oximeter as an indicator of COVID 19 has been the subject of debate in recent months. People have become accustomed to have their temperature checked during the pandemic because fever is a key indicator of COVID 19. A new commentary by medical scholars, however, proposes that taking a temperature is a less useful indicator of infection in older adults and that a pulse oximeter be used instead. The commentary by Washington State University College of Nursing Associate Professor Catherine Van Son and Clinical Assistant Professor Deborah E.T. has been published in Frontiers in Medicine. Oximeter or not, the reliability of a pulse oximeter as an indicator of COVID 19 has been the subject of debate in recent months. In January, the World Health Organization listed the use of pulse oximeter to identify COVID patients who may need to be hospitalized due to low oxygen level. But in February, the US Food and Drug Administration warned that pulse oximeter could yield inaccurate results under some circumstances. It said a number of factors, including poor circulation, skin pigmentation, skin thickness, and temperature, can affect the accuracy of the reading. Also in February, the US Centers for Disease Control and Prevention updated its coronavirus guidance to warn healthcare professionals that data from a number of studies suggest skin pigmentation can also affect the accuracy of oximeter readings. The commentary. The newspaper makes a case for preferring an oximeter to a temperature reading in older adults. Specifically, it says baseline temperatures are lower in older adults. A lower baseline temperature means a fever may be overlooked using CDC standard definition of 100.4 degree Fahrenheit or greater. Washington State University said in a press release on the paper. In fact, upwards of 30% of older adults with serious infections show mild or no fever, the paper said. The authors note that the other common signs of COVID-2 may also be dismissed and attributed to aging, such as fatigue, body aches, and loss of taste or smell. Additionally, some COVID-19 patients have no visible signs of having low oxygen level, such as shortness of breath, yet have oxygen saturation below 90%. Such asymptomatic hypoxia can be associated with extreme poor outcomes. Van Son and A.T. write that inexpensive portable pulse oximeter should be considered for wider use in COVID-19 screenings of older adults because the devices can detect changes in oxygen saturation without other indications of infection. Thank you.